This podcast is brought to you by cubpub.org, the blog of the Columbia Political Union.
Hello and welcome to the inaugural episode of the Pubcast, Columbia Political Union's official podcast. I'm Ismail Muhammad with
Adam Kurvitz,
Paco Martin del Campo,
Bruce Garrow,
Michelle Yuan,
Tim Lamb.
And today we're going to be discussing the momentous events that happened last week regarding passage of healthcare reform and I guess you could say a little impasse between Israel and the United States regarding Israeli settlements. And we'll start off with reviewing what's in the healthcare bill. I know Tim has some objections to what's in the bill regarding taxes. Yeah.
So there are two ways that this bill is actually going to be financed, or two main ways that the bill is actually going to be financed. Starting in 2014, there's going to be a 60% increase in the Medicare payroll taxes. And then also in 2018, there will be a 40% excise tax on high-cost health insurance plans.
The Cadillac plans.
Right. And it's just, there. In addition to that, there are also fines that are going to be imposed on individuals who don't have insurance. A lot of people consider those fines to actually be like taxes, because essentially individuals who don't have insurance will end up having to pay a fine of like 2.5% of their income. So those are just areas of concern, I guess, to more conservative people, more Republican-leaning people.
And I'll just add, in addition, there is a tax on couples making more than $1 million to help pay for the subsidies for extending health care. But just to play devil's advocate, isn't it a good thing that these taxes are being blown off until 2014 and up to 8 years in some cases? I mean, considering the state of the economy, it could be worse if they were being imposed on right now.
They could be, but at the same time, the impact on like how other countries perceive our debt level is not going to be changed because we are still taking on this added amount of debt. Now, of course, like to the American people, it's going to be it's going to hit their pocketbooks a little bit later, but it's still not necessarily going to help our fiscal situation to be taking on big projects such as this $940 billion healthcare overhaul.
No, you mentioned debt, but taxes will hopefully pay down the debt and keep the healthcare costs from skyrocketing. I mean, at least that's the big idea behind the taxes. I mean, just to play devil's advocate. But
I have a comment. Another reason why a conservative might have concerns over supporting this bill is that a lot of these costs are like difficult to predict. So the government doesn't actually know at this time exactly how much liability they will be picking up, because a lot of these subsidies are based on predicted healthcare costs, but there are other things in the bill that could change exactly how much the government is paying out for these subsidies.
Okay.
And yeah, just to add on to that, maybe from a liberal standpoint, there's the issue of undocumented immigrants who can size anywhere from the number, obviously it's very hard to quantify it, but anywhere from 12 to 20 million undocumented immigrants in this country who don't have health care. And
who won't be covered by this bill.
Who will not be covered by this bill. And moral like arguments aside, from a fiscal standpoint, that's just going to result in in undocumented immigrants just staying away from doctors until they have to go to the hospital. And of course, that eventually puts the bill on the taxpayers in the end. And so
that was a very short-sighted decision on the part of Congress not to include them.
And I think to expound on that idea that you'll have people, the preventative care won't really come out of this bill, is the fact that there is no real proper individual mandate. So in other words, there is no incentive for young people really between 26 and the age when major diseases and problems start to become costly. There's no incentive for that group to enroll in an insurance plan because the 2.5% of their income or the $700 minimum fee that they would incur for not being insured is less than getting something. And if you have no major health problems at that time, it makes more financial sense to just be uninsured. ERs still have to treat people legally, so there is that emergency net there, and that will not only undermine the amount of funds available for people who do need care later in life, but will also exacerbate that problem of not really being sure how many people are out there.
But Ishmael, what you said with the taxing in the future rather than taxing now, like the government just gave tax breaks to big corporations, and like now that they know that they're going to have to pay higher taxes in the future, what kind of feeling does that leave for companies?
What are the qualifications for companies being taxed? I know that the small business qualifications, small businesses with more than 50 employees will pay a tax to cover their employees. But most, I think something like 80% of most small businesses in America are less than 50 employees. But what are the responsibilities of corporations?
Well, firms with more than 50 workers who do not offer medical coverage will have to face fines of like $2,000 per employee, and just like larger employers will have to have bigger penalties if they don't offer health benefits at all. So
most of those victims, I guess, would be large corporations, right?
Yeah, large corporations. Yeah.
Well, basically one of the factors inflating health costs is the fact that these businesses get tax breaks. A lot of these Cadillac plans are offered by the biggest companies.
Offered by unions.
Yeah, that as well.
Which is
so basically anybody not protected by these interests by unions and the companies is suffering from this. Mm-hmm. Any individual or anybody part of a small business, and the government who picks up the cost.
Well, this brings up, I think, a pretty interesting argument. I know during the healthcare debate, there was a lot of talk about settling business with the cost of healthcare to supply to their employees. I guess I want to direct this to the more conservative members of the panel. Wouldn't that burden be lessened if we moved in the direction of a more government-based healthcare system, where the burden was taken off of business to supply healthcare benefits?
I think that's kind of going to happen given the way the legislation is set up right now. Given the really generous government subsidies for people who don't have insurance through their employers, I think there's a major incentive for even medium-sized companies that have 100 employees or fewer to dump those employees on a state-based system or on these government subsidies. If you have a company, say, with like 100 people working for it, and they offer or help subsidize insurance plans for, say, $10,000, it would work out to be something like the employees pay $2,500 of that, and then the employer would pay $7,500. So multiply that by the number of employees, and in most cases for companies of around 100 people, it works out for it to be vastly cheaper to have those employees just be on a state system with federal subsidies. So I think that may happen just under the way the legislation is set up now.
And just to let's enter ideal fantasy land for a moment, how would a single-payer system affect the current employer-based healthcare delivery system? If the government were to be supplying every citizen or almost every citizen with healthcare, would that be good for business? Michelle, you're our resident Wall Street expert, I guess.
I think that it wouldn't be good for businesses because they're the ones who have to finance these the health, they have to.
Not the taxpayers.
Both, right? So, wait, what was the question?
Well, just a single-payer healthcare system where the government supplies, something like in Canada, where the government supplies every citizen with healthcare, a state-run healthcare system. I'd be guessing most citizens would be paying into the healthcare system.
But it's also taxing bigger corporations too, right?
Sure.
So they'll be hurt as well. And also, I just think that the whole problem with this bill is that it's not really reducing costs, but rather like shifting the liabilities